Is your child snoring like a baby bulldog at night? You might think it's cute, but I'm here to tell you snoring is not normal. Sure, if they've just run around Disneyland for 12 hours straight and pass out in the car, head flopped back, mouth wide open, a little snore might slide out, but that's situational. But routine snoring every night, that's a red flag. In this video, we're gonna break down exactly why kids snore and what it can mean and how it can affect their health and growth. And most importantly, what you can do about it. Tonsils, adenoids, CBCT scans, jaw expansion, plus a couple solutions you've probably never heard of. Hi, I'm Dr. Jeremy Manueli, board certified orthodontist and dentofacial orthopedist in Las Vegas. On this channel, we help parents like you understand your child's airway, facial development, and overall sleep health. If you've ever wondered whether that little snore is harmless or something more serious, stay with me. You might be surprised. Snoring is caused by vibration of the soft tissues in the throat due to a restricted airway. And while snoring can be a punchline in sitcoms, in real life, it's often a warning sign. And in children, those soft tissues should be vibrant and firm. So if they're already snoring now when everything should be at its peak, just imagine what it'll be like when they're 40 and married, and their spouse is Googling tiny sleep divorce beds. So here are some common causes of snoring in kids: enlarged tonsils and adenoids, narrow airway and nasal passages, mouth breathing, poor tongue posture, and a protruded or underdeveloped upper or lower jaw. We used to think sleep apnea was the only real concern, but now we know that sleep disorder breathing is actually a spectrum, and snoring is on that spectrum. It disrupts sleep, it can affect oxygen levels, and can even affect growth and academic success. So here's why all this matters. Chronic snoring can cause daytime fatigue, it can mimic symptoms of ADHD, and this one is huge. Some studies show up to 50% of kids diagnosed with ADHD were actually just sleep deprived. And after tonsil and adenoid removal, only half of them still met the ADHD criteria. Sleep deprivation and ADHD can look very similar, but only one can be cured. Another thing it can cause is impaired growth. Growth hormone is released during deep sleep. If your child isn't sleeping deeply, they likely aren't growing normally. Another thing is reduced academic performance. Your brain on poor sleep can't focus. And also this can lead to poor jaw development and facial growth. Because growth primarily happens during the nighttime, the direction of growth is influenced by the position of the lower jaw during sleep. That means if your mouth is hanging open and your child is snoring, the growth tends to be more downward and backward, which continues to increase their risk of more severe sleep problems later in life. And here's the wild part. Kids often compensate in ways that mask the issue. They sleep on their stomachs, they extend their necks, they shift and thrash around in bed all night, and if you're not watching closely, you'll miss the signs. So what should you do if your child is snoring? Well, you can start right at home by simply observing your child as they sleep. Do they snore frequently? Do they sleep with their mouth open? Are they tossing and turning? Do they still wet the bed at an older age? This could be linked to poor sleep quality. You can also get some tools that really help paint a picture of your child's sleep. Sleep apps like Snore Lab can track frequency and intensity of snoring. Pulse oximeters, which watch for oxygen drops and heart rate spikes, can be indicative of apneic events during sleep. And video recordings to catch mouth breathing and apnea moments can also help to understand the severity of what's happening with their sleep, and can also help you better advocate for your child when you seek help from providers. Another thing you'll want to look into is obtaining a CBCT 3D image for your child, just like this one here. In my office, we take this image on every single patient as part of their initial consultation. And it allows us to clearly see and assess a number of things, including the tonsil and adenoid size, not only the traditional way by having them say ah, but with this image, we can actually see where the tonsils rest when the mouth is closed. We can also look at and assess the jaw shape and size. Oftentimes in kids who snore, we see that the jaws are anywhere from 5 to 15 millimeters too small. These discrepancies are significant and not something that a child is just going to grow out of. We can also take a close look at the nasal passageways and the sinuses to see if there are significant inflammation or blockage. Being able to see and visualize what's wrong is the first step to finding solutions. And if you're serious about helping your child sleep better, our team at Hamilton & Manueli Orthodontics can help. If you're here in Las Vegas, head over to hmortho.com to book an in-person consultation. And if you're not local, head over to vegasorthodoc.com, where you can upload your records securely and we'll review everything together remotely to see what's really going on and help steer you in the right direction. So now let's talk about solutions. The first three things we always look at when a child is snoring is tonsils, adenoids, and jaw size. So first, let's talk about tonsils and adenoids. If they're huge and blocking the airway, having them removed can significantly reduce snoring and improve oxygen flow. But if the nasal structure and the jaw are also restricted, snoring can return as they get older. Think of this like a first step, not the finish line for many kids. So what can be done about jaw size? Well, this is actually my direct specialty, and the answer is maxillary expansion. Expanding the upper jaw makes more space in the nasal cavity because the roof of the mouth and the floor of the nose actually share the same bone. With expansion, the jaw also moves slightly downward and forward, taking the tonsils and the tonsillar pillars with it. In some cases, just expanding the jaw leads to enough improvement that the tonsils and adenoids shrink on their own over time, and you might even be able to avoid surgery altogether. Now, traditional maxillary expansion works best in kids aged 5 to 10 because their bones are still soft and pliable. As kids get older, the bones mature and harden, and we may have to use a more substantial type of expander like a MARPI, which stands for Mini Implant Assisted Rapid Palatal Expander. This is where small pins are added to the bone directly to ensure that the bones move and not just the teeth tipping outward. Now that's for another video, but trust me, it's a game changer for patients who might have otherwise missed the window for traditional expansion. And this can now even be done on adults into their 70s, just like this case here. So what about other options? Let's talk about lip taping. Lip taping for kids 5 and older may also be a great way to combat snoring, as it encourages nasal breathing and helps train the brain and body to stay in the proper nasal breathing mode. We actually just finished a deep dive video into the safety and methods for lip taping, and you can find that right here, so be sure to check that out. Another thing you'll want to address is allergies and nasal obstruction caused by inflammation. Nasal rinses, antihistamines, allergy meds can all help to reduce inflammation. Mouth breathing often starts because of nasal issues, and switching back to nasal breathing often helps break that cycle. Another thing worth looking into is something called myofunctional therapy, and think of this like physical therapy for your tongue. Yes, you can work out your tongue, and yes, it makes a difference. Stronger tongue muscles help to hold the tongue forward, even at night, preventing airway collapse. There's even straws and FDA-cleared devices like Excite OSA, which train the tongue during the day for better function at night. Okay, so let's recap. Watch your child sleep, use your phone to record, try an app, get a pulse oximeter, and really get curious. You can also schedule a CBCT and exam with our office. It's quick, comfortable, and will give you the full picture of your child's airway, sinuses, and jaw size. Already have a CBCT scan? Feel free to upload it to vegasorthodoc.com and we can review it together. We'll help you make sense of what's going on and what to do next. My name is Dr. Jeremy Manueli. Thank you for being here. Be sure to hit that like button if this video helped you. And subscribe for more no-fluff practical advice from someone who actually treats this stuff every day. And tell me in the comments, does your child snore, or have you been told they'll just grow out of it? Let's get them the sleep they deserve. Thank you for watching, subscribe as always, and I'll see you in the next one.